Hello, everybody. Today I'm going to be telling you a little story about myself. So a few years ago, I got this excruciating pain in my stomach, and this pain wouldn't budge. It stayed with me for a week and a half. I couldn't sleep, I couldn't eat, I couldn't even go to school. So at the beginning, I took a few pills in hopes of getting better. But I didn't. So naturally, my father took me to a doctor. But I didn't go to just one doctor. I went to 5, 6 doctors around Tehran, and no one could have figured out what was wrong with me. Until this one doctor I went to, and he asked me questions like a normal appointment, and he asked me, "What was wrong with you?" And I answered his questions. So he guessed what was wrong with me and gave me some pills and medications. But the difference about this doctor, the different thing about this one doctor was that he told me that if I didn't get better with these pills and medications that he gave me, I will be needing to get an endoscopy. And naturally, a seventh grader, a 12-year-old, wouldn't know what an endoscopy is. So the first thing I did when I went home was search it up on the internet, what is endoscopy? And a video popped up for me, and what I saw traumatized me. I saw a woman taking a tube, an endoscope. It was entering her body, and when it entered her body, she started gagging a lot. Her eyes started watering, and she was fidgeting uncontrollably. She was very uncomfortable, and I felt that across the other side of the device. So I got scared. I was terrified. So I went to my dad. I was like, "Baba, I'm not getting an endoscopy. I would rather deal with this pain my whole life, but I would not get an endoscopy." And my father, wanting to calm me down, told me, "Yassi, let's hope these pills and medications work. So you won't get the endoscopy done." And miraculously, they did. So I forgot about this phase in my life because I was a kid. But then, a few weeks ago, a dear friend of mine had to go get an endoscopy procedure for some health reasons of hers. She was chill about it. She was okay until the day of her appointment. The day before her appointment, actually. She started messaging me, and she was like, "Yassi, I'm terrified. I don't know what to do. I'm so scared." She came to the conclusion that if she was not going to go under sedation, she would not get the procedure. And that led me to think, in this day and age, with this kind of technology that we have, why do we not have an alternative to this terrifying procedure? The endoscopy procedure was made in the 1800s, and today we are in the 21st century. And yet we still use the procedure that was made in the 1800s. Why isn't there an alternative? Why isn't technology doing what it's supposed to do? Technology's aim is to help people out, to make people's lives easier. And yet, it's not doing its job here, so what's going on? What's wrong? Why isn't there an alternative? And that is why, ladies and gentlemen, I, Yasmin, Majeed, and my partner, Vanya Fattahpour, are here today to introduce you to a new device that diagnoses diseases in the GI system, an alternative to traditional endoscopies, capsule endoscopy. To begin with, we need to see how traditional endoscopy works, and that is what my partner will be explaining.
There are two kinds of endoscopies that capsule endoscopy can be an alternative to. But before we talk about how they work, what's the procedure, let's just talk about what an endoscope is. An endoscope, it's a long flexible tube that has a camera at one end and a light on the other hand. This endoscope is connected to a monitor, meaning when it enters a patient's body, the doctor will be able to analyze the internal organs or tissues of the patient. So, we have two kinds of endoscopies. The first one is upper endoscopy, and the other one is colonoscopy. The first one is upper endoscopy. Upper endoscopy, it works by having an endoscope enter the patient's mouth and go through the esophagus, the stomach, and the beginning of the small intestine, which is known as a duodenum. The next one is colonoscopy. Colonoscopy, it's the opposite of upper endoscopy. How it works, the endoscope is going to enter through the rectum and it's going to reach the end of the small intestine, which is known as the terminal ileum. However, the problem that these two endoscopies have is that both of them reach the end and the beginning of the small intestine. None of them can go through the small intestine to see what problems they have. So that's why, unfortunately, to this day, none of these endoscopies were able to achieve the accomplishment to go through the small intestine completely.
So my partner just stated one of the problems we have with traditional endoscopies, but there's a bunch of more problems. And today I'll be talking about the problems. One of the problems is wounded organs. What does that mean? That means holes in your organs. You may ask, how is that possible? Well, when an endoscope, a tube is entering your body was not made for that tube to be entered. So of course, there will be some consequences, and these are one of the consequences, holes in your organs. In addition, when you get holes in your organs, you may get excessive bleeding. May I remind you, sometimes excessive bleeding also happens when you don't get holes in your organs. It just happens because, again, the tube was not supposed to be entered in a human body. And when you get excessive bleeding, it may lead to infection. It may lead to fatal things, which these fatal things will then on lead to maybe a risk of surgery, which none of us want here. In addition, something all of you are aware of, this procedure is invasive. Just imagine a tube entering your body through your flesh and guts. Now, did that make you uncomfortable? Think about it 100 times worse during the procedure. That is not what we want for people. And fourth, this procedure requires sedation. Some of you actually might argue with me here, telling me no, endoscopies don't always require sedation, and yes, I agree with you. But guess what? When people don't get sedation, they are in extreme pain. They're gagging, they're crying, their eyes are watering, they're fidgeting, and they're uncomfortable. They would be severely uncomfortable. They wish they got sedation. And fifth of all, it has restricted access, as my partner stated. One of the biggest problems is that it cannot see through the small intestine. When it can't see through the small bowel, if you have pain and the pain was caused from the small bowel, your doctor will not be able to diagnose you. So when you can't be diagnosed, you won't be treated. And we need to find a solution for this. To make matters even worse, 250 million endoscopies happen a year in a single year globally. Think about yourself. What if you were one of these 250 million people? You had to go through extreme pain for a procedure that didn't even treat you. It's just used to diagnose you, to check what's wrong with you. And yet you're more scared for this procedure than the actual procedure that you will be needed. To show you the bigger picture, these are upper endoscopy indications. So we use endoscopy for two reasons, to diagnose and to follow up. What does that mean? That means sometimes you're in pain, you have symptoms, so you need to be checked to be diagnosed. And that is what diagnostic here means. That means using endoscopy to see what is wrong with you. And follow-up means you already were diagnosed, you had a procedure, and we just want to see how well or bad you're doing. These are indications, meaning symptoms and diseases that are 100% needed for upper endoscopy. And there's more to it. These are indications of colonoscopy. May I remind you, again, these are just symptoms and diseases that are 100% needed to get an endoscopy for. Sometimes you may have symptoms, other pain, other diseases, and you will still need endoscopy. So as you can see, we're seeing a pattern here. People that are in pain, extreme pain, vomiting, abdominal pain, post-surgery, people with immense amount of stress are needing to get endoscopies. And what are endoscopies? They're painful, they're stressful. And We need an alternative for these because we want to help people out. We want to use our technology to help people out, to make their lives easier. People that are already in pain, people that are already dealing with stress. Why do they have to go through the stress of a procedure that just diagnoses them and checks them? We need, so what device can be used instead of them, instead of endoscopies? And that is, ladies and gentlemen, capsule endoscopy. So capsule endoscopy fixes it all. How? Any problem you have with traditional endoscopy, capsule endoscopy fixes. What do I mean by that? As you can see here, capsule endoscopy is non-invasive. It's completely painless. There's no more tubes entering your body. It's a vitamin-sized capsule that you will be taking with water. You won't be hurt. You won't feel anything. It's painless. And to add on, you remember the wounded organs we got? The organs that where a hole was made into them because of the endoscope? That doesn't happen anymore with capsule endoscopy. It can't hurt you. And we don't have wounded organs, we don't have excessive bleedings. When we don't have excessive bleeding, we don't have fatal things happening to us. And there's no risk of surgery anymore as well. To add on top, there's no need for sedation. Because sedation is used when we are going through a procedure that is painful. This procedure, as I said, is completely painless. And also, capsule endoscopy doesn't only fix the problems we have with traditional endoscopies, it gives us some benefits. What are the benefits? Comprehensive visualization, meaning this is a very high-tech device. This device has a high-quality camera with a light that would be entering your body, and the light would be lighting up your GI system, and pictures will be taken every millisecond. So when it takes pictures, such high-quality pictures that your doctor will later on see, they will easily diagnose you with what's wrong with you. So it's very high-tech. And as well, the biggest problem we had, the extremely important problem we had with traditional endoscopies, not being able to see inside the small intestine, that is fixed with capsule endoscopy. Capsule endoscopy will be able to go through your small bowel and your small intestine, and it will be able to take pictures of it, and your doctor will easily diagnose you. So if you had pain and the cause was in the small bowel, congratulations, now you can be diagnosed and treated. So you may be thinking to yourselves, this is quite impossible. We went from painful, invasive, traditional endoscopies to a sudden of painless, non-invasive, no problem, advantage after advantage, capsule endoscopy. There's something I'm not saying, right? Well, you're wrong. I've told you everything. You might be thinking, what about the procedure? Why haven't you told us about the procedure? Well, I'll be telling you about the procedure. My partner will be telling you about it.
How does the procedure of capsule endoscopy work? As me and my partner we stated, traditional endoscopies work by having an endoscope enter through your mouth or go through your rectum. But capsule endoscopy is way more easier than that. So how does it work? The first step of capsule endoscopy is basically the patient is going to have a few patches attached across their chest, and each and one of these patches are going to be connected to a wire, and all these wires together, they're going to be connected to a recorder which is going to be worn around the patient's waist like a belt. The next step is the most easiest but the most crucial step of this process. The patient just needs to take the capsule with water. A capsule that's really small, a capsule that's the size of this pill. It's so easy, and I'm sure half of you guys can't even see this, just showing you how little and easily it can get digested. When this capsule endoscopy goes through your digestive tract, it will take thousands of pictures of your internal organs or tissues. And the most amazing part about this procedure is that all of these images can be transmitted wirelessly through the recorder that the patient is wearing. And all these images that are going to be sent to a computer that has a special software in which all these images are going to turn into a video. meaning that after the procedure, the doctor will be able to analyze this video to see if there's any problems, any tumors, or any bleeding, and if there is, to diagnose the patient and recommend further treatment.
So as you can see, capsule endoscopy is advantage after advantage. It's good after good. There's no problem with this. While traditional endoscopy is disadvantage after disadvantage. Pain and stress after pain and stress. This is why, ladies and gentlemen, me and my partner made this presentation to aware you of this device. This device that is very high-tech, that is able to make a procedure that was very hard, very stressful, and very painful for us easy. We wanted to thank you everyone for listening to us, and thank you to a special thanks to our principal, Ms. Dai, our counselor, Ms. Hosseini, our supervisors, Dr. Majeed, Ms. Pakizekar, and Ms. Baqiri. And thank you to the Boys School for giving us this opportunity. Thank you, everybody.